Good afternoon. My name is Hines, and I'm the chair of the Northwest Portland Area Indian Health Board, and I also serve as the chief executive officer of the Yellowhawk Tribal Health Center, which is owned and operated by the Confederated Tribes of the Umatilla Indian Reservation. Just the little bit that I've already sat here, and I'm sure you guys know this, the comments that I'm going to share with you are no different than what you've already heard so far, just in a different way, in a different form. But I think our message across Indian country is the same, and I think you guys are hearing it so far, and I hope the committee does take to heart what we're sharing with you, as you are already hearing the direct impacts that IHS has on our tribes and our members, or the lack of action from the administration. And so as we talk to you as our elected officials, we really do hope that you hear our words, because as it's already been mentioned, that these words have been shared time and time again, year after year, the same message over and over, yet there's little to no action that has a great impact. And so, but that's not going to deter us from coming here time and time again to share the same message over and over again until we are heard, so that we can ensure that the services that are supposed to be provided to our people are met. And so on that note, I'll start off with, our first request is to, again, ensure that this committee, as well as Congress and the administration, continue to honor the trust responsibility that the federal government owes to the tribes, and to uphold the legal and moral obligation of the treaty obligations that are outlined in all of the treaties that we have with the tribes, and to ensure that these words that have been written and agreed to by the leaders that came before us are not fallen on deaf ears. It's already been noted, but again, we'll say it again, that our first ask is to take a look at the advanced appropriations as we look to FY 26, 27, 28. That number that has been noted already, $76 billion, and looking at what's currently in the budget for FY 26 is just a little over $8 billion. So there's quite a bit of a shortfall as it comes to fully funding IHS. And so towards that end, as we talk about mandatory funding, whether it's for 105L leases or contract support costs, which on that note, it was a win a couple years ago when the Supreme Court did rule that contract support costs did need to be covered through IHS dollars, that while that's the ruling, one thing that wasn't added was that there was not more money appropriated to IHS to help cover those costs. And so that is a concern that we have still, and even prior to that, is that this pie continues to get sliced smaller and smaller and smaller. And so we are doing our best on our end, and I think was just shared by Ms. Lucero, that we can do that magic when those dollars are appropriated to us. We best know how to utilize and spend those dollars. And as it pertains to the Portland area, we are one of the areas that has no IHS or 638 hospitals. And so for our funding and in our request to IHS, we look to increase our purchased and referred care dollars. And so until such time, and we are currently working on a specialty referral center for the Portland area, and until such time, though, as the rising cost of healthcare continues to go up, and without an increase to PRC dollars, that is a concern for us, as while our tribes are doing their best to be sustainable, whether it's through third-party billing or other means and resources, this is a concern for us. And again, probably just on another note, we'd like to see that some of these dollars that come through, whether it's for the special diabetes program for Indians or the behavioral health initiative, that those grant funding opportunities be redirected back through contracts and compacts to tribes, so that we're not competing for these dollars. That has been an ongoing concern and issue when we have to compete with our fellow tribes to try to obtain those dollars, because they do have great impacts on our communities. I know I can speak for the Umatilla tribe that the behavioral health initiative dollars that we've received has been tremendous, especially as mental health has been a huge issue in our area, and especially after dealing with COVID and seeing a mass exodus of the behavioral health professionals following that now more than ever that's one of our top issues that we're dealing with, as well as diabetes and obesity in our community. But this is just an example of again, we need the money, and we hope that this committee can carry that message to the full committee, to the rest of Congress, and we'll continue to work with the administration on there's a lot of issues that we need help on and we look forward to working with you, and thank you for your help.